In your morning checkup, October is Breast Cancer Awareness Month. The American Cancer Society says there is a rise in lobular breast cancer rates among American women. Wish TV medical expert Dr. Janelle Gordon is here to help us understand this. And this just came out, this update on this type of cancer.
Just came out this week from the American Cancer Society.
Okay, I was asking you in the break, I didn't even know there was a difference when it comes to breast cancer. So what is this? How do women know about it?
Yes, so there are different types of breast cancer. We're more commonly used to hearing about ductal carcinoma of the breast. However, this is lobular cancer of the breast. So think that the lobules are the glands in the breast that actually produce breast milk, and then the ducts are what carries that milk through.
Okay, how common is this?
Yes, so it's actually the second most common. 1 in 10 women are affected, and we're projected to see over 30,000 women diagnosed alone this year.
How do women know that this is something they might have?
So unfortunately, as opposed to mass that individuals may feel with other types of cancer, when it comes to lobular cancer, you may not feel a mass at all because it grows in a more linear pattern or a dispersed pattern. And so individuals may only see subtle dimpling of the skin or even slight nipple retraction.
So they might kind of just notice something that is different. What should women do to be tested or make sure that this is something they don't have?
Exactly. So we recommend that women who are at average risk for breast cancer, meaning no personal or family history of breast cancer, no history of any head and neck radiation, that they be screened starting at age 40 years old and have a mammogram annually. However, when it comes to this specific type of cancer, it may not be picked up as well on that imaging, and individuals may need more advanced more advanced testing, such as a breast MRI or even a mammogram with contrast.
So kind of if you think something seems not right, you should keep pushing. You said there is a rise with this type of breast cancer. Why do you think that is?
So some factors that could be contributing to the rise that we're seeing in this particular cancer could be earlier onset of menstruation for young girls. We're also seeing that women are having children at later ages, menopause is occurring at a later age, obesity rates are rising throughout the country, even the world, and we think that these could be contributing.
If you have this, what's the prognosis?
So actually, thankfully, the prognosis up to 7 years is over 90%.
Okay.
What we're seeing, however, is as you get further and further out from treatment, going towards 10 years, and if you have more regional breast cancer, lobular breast cancer, meaning it's not localized, or more distant stage disease, those individuals don't have as great of a prognosis.
And sometimes with this, because it's hard to tell, people are finding out about it at later stages.
Yes.
If women are watching this, worried, is there something I can do to better protect myself? Is there anything?
I highly, highly recommend screening. Some individuals feel like it would be better if they didn't know, but we can catch things earlier today with our advanced imaging that we have. So please make sure you're keeping up with your mammograms. Know your family history. And if you're, I don't know, grandma doesn't really talk about it, talk to her daughters, your aunts, your mom, and see if you can get that information. Or go to grandma and say, I just want to make sure that I'm doing well. I know this may be uncomfortable. You don't have to answer, but it really would help the rest of the family. Make sure you're not smoking. Limit your alcohol intake. As I said in a previous morning checkup, the Surgeon General's warning last year did show that there are increased rates of breast cancer tied to increased alcohol intake, as little as 1.5 drinks a day. And so it's very important that we're taking care of ourselves, eating plant-forward nutrition and staying physically active.
Quickly before we go, is this for a certain age, or is this something all women should be thinking about?
Surprisingly, what we've seen is for lobular cancer specifically, the rates are rising across age groups.
Okay, all right. Dr. Gordon, thank you so much. We appreciate it.